So we have Richard in today, sports teacher, and overall good health, but he's got some neck and shoulder complaints that he's come in to see for. And typically, before we do anything, I want you guys to take a look at this. So this slumped over posture, okay? So again, look at the difference here. If we put him into a more neutral position, we neutralize his lumbar spine, bring his shoulders back, and you can see just the overall drag on the suboccipital muscles, the cervical muscles, and the trapezius is much less than in that rounded position that he was in, okay? So that's one of the things we're going to talk to him about improving is his posture. We'll give him a postural exercise to really neutral out his lumbar spine, bring his shoulders back, and really put his head into neutral. So we'll do a little examination, check out his neck, see what things look like, because he is complaining of some upper neck tension, some shoulder tension, which is a real common complaint for people who are real active, especially people work at a desk or outside doing all-day activities. Turn your head to the right for me, far as you can go. Any pain with that at all? Good. And turn your head to the left, far as you can go. Any pain with that at all? Good. So right is fairly good. He's got a little tiny restriction in left rotation, but not too bad. Ear to your shoulder, far as you can go. And again, a little bit of restriction. Going to this side, better. This side kind of sticks in through this area here. So we're going to take a look at this left side of the neck, see what things look like, okay? Chin to your chest, far as you can go. Any pain with that at all? No. Good. And now bring your head all the way back, and any pain with that at all? No. Good. Perfect. And again, I'm going to put him into the neutral position. So we're going to go ahead and do some palpation of the cervical spine. I'm going to just feel, see if there's any tenderness, any pain, okay? So if I go in here, any pain at all, any sensitivity in this area here? Yeah. So he's got a little bit of tightness in this left side as compared to this side, which is tight. But any tenderness in here? No. So a little bit of capsular swelling. These cervical spine joints, these are gliding joints in the posterior neck. You have 7 bones in your cervical spine. He's got a little bit of dysfunction, joint dysfunction in the cervical spine on the left side. So spine, he's got a little bit of restriction in this joint capsule. I'm going to take a contact. Have him take a deep breath and relax and drop your head, let it go. Good, and just got a nice little release there. Any pain with that at all, Richard? Nope. No. Good. So typical chiropractic adjustment should never ever cause any pain at all, okay? We heard a little noise there, that's called the cavitation. That's a bubble being formed when the pressure in the joint changes. Sometimes you get a loud cavitation, sometimes you don't get a cavitation. We don't adjust for the noise, we adjust to clear the restriction. Secondary restriction in his cervical spine, we're going to take care of that as well. Take a deep breath, blow it all the way out, drop your head, just relax and let it go. Good. And real easy restriction release. Any pain with that at all? No. Good. And again, treatment shouldn't hurt. Go ahead and check his range of motion now. We're going to have him turn to the right far as you can go. And that's full range of motion to the right, no problems with that. And left far as you can go. And you can see a little bit more mobility and rotation. Huh? It wasn't restricted much on that left rotation, but again, from right to left now, really not a lot of difference. Now let's check the lateral bending, ear to the shoulder far as you can go, and that was good as it was, and now left far as you can go, and again, improvement in range of motion. And what we'll do now here is we'll work in these upper trigger point areas. We'll use a hyperbolt, the soft tissue recovery tool, to work on that. Both in the upper trapezius area to relax the muscles, get rid of this metabolic waste product in the trapezius muscle called the trigger point. Again, a little bit more aggressive. It might cause a little bit of temporary soreness or not at all. A lot of patients love it. So I'm going to ask Richard, how's that feel? Is that okay? Good. So again, not a lot is needed here. We'll hit this for about 30 seconds to a minute, working this trapezius muscle to disperse the toxins in here. And this should be enough to get rid of that metabolic waste product. Now, a lot of times with patients who have chronic issues, they'll need repeated treatments because the body, the tissues, they don't recover overnight. They do take time to heal, and everybody's healing time is dependent on their age, their health, and how long the condition's been going on, and if there are any other medical factors involved. Volt on this opposite side. Disperse this trapezius trigger point that he has. Okay, Richard, any problems? Good. Working some of the parascapular muscles. Again, because of the way he carries himself all day long, puts a lot of overstretch on the scapular muscles. His pectoralis muscles are short and tight, and the posterior upper back muscles, they're overstretched and weak. So we have to kind of even him off to prevent this scenario from carrying on. So we're going to show him a postural exercise that he's going to do throughout the day that's going to, over time, train him or reprogram his brain to have a little bit better posture. The neck addressed, what we need to do is we need to remove the secondary area of fixation, which is in the dorsal of the thoracic spine. We're going to do a thoracic manipulation to open up these joints in here, get some mobility. So Richard, go ahead and sit for me right here. You'll hold it. You're going to blow it out. As I drop you back, you might feel a clicker pop in through this area here. Drop your head just like this. Okay, go ahead and take a deep, deep breath. Deep breath, hold it. Come down with me. Blow it all the way out. Drop your head back. Really good. Okay, so nice release. That whole dorsal area released. Very good. One more in that thoracic area. Deep breath, blow it out. And good. And yeah. So that was just waiting to go. Didn't have to do a lot in there. So that's the thing about the chiropractic adjustment. If we set it up correctly, those joints will just slide in. Swing your legs right over here. Business now that we've taken care of the areas of spinal dysfunction is we're going to do a little training for his posture. So Richard, go ahead and put your feet on the ground. Good. Okay, so I'm going to teach you this Brugger's exercise. Okay, and the Brugger's exercise has 4 component parts. Okay, so step 1, shoulders back. Okay, great. Step 2, rotate those arms out like this. Perfect. Step 3, tummy tight. And step 4 is the hardest. Chin tuck in, so retract. Good. Now you're going to breathe through your pursed lips, and you're going to hold this position for 10 to 15 seconds, and you repeat it 5 times throughout the day. Now, what I want to stress is 2 things. Relax for me. When you do this, it shouldn't be tense, okay? So it's 1, 2, tummy, chin. Perfect. Shoulders should stay down, and make sure you breathe, okay? 10 to 15 seconds. 5 times a day throughout the day, okay? Seated and standing. Perfect. In the standing position, because Richard's up all day, he doesn't do a lot of sitting, so it's really important for him to practice both standing and seated. Step 1, shoulders back. Again, now the natural inclination is to bring it up. No, okay? So straight back, rotate, tummy, engage the core, and that chin. If you see the double chin, he's doing it correctly. Now notice, the chin is parallel to the floor. It shouldn't be up, shouldn't be down. Parallel to the floor. And he's a sports teacher, so he knows the importance of good musculature, okay? And see, we've engaged his scapular muscles. They're contracting, bringing his shoulders back. And now we're stretching out these pectoralis muscles, which are really tight on him, which are causing him to round his shoulders, okay? So we're really engaging the muscles with this Brugger's position, okay? And here's the thing about Brugger's. It's not necessarily an exercise for the muscle, okay? We're training the brain. We're forming a pathway between the brain and these muscles, making a connection to override the pattern which is front dominant, yeah? Great.